In our cNEURO cloud-based platform, we have two products approved for use in Europe, the US, and in Brazil. We'll start with cMRI. cMRI is a tool used for the quantification of brain MRI images. Here we have some images from a secondary progressive MS patient. cMRI segments 133 regions of the brain and calculates the volumes of each region and compares them to normative data from about 1,500 healthy controls. It can be used for any disease where you want to quantify volumes from T1 and FLAIR images. In cMRI, you can assess the quality of the segmentation results by checking segmentation on the images. Volumes and other imaging biomarkers are displayed on the left here. cMRI also gives percentiles to show you where that patient sits compared to the healthy controls. We have also developed disease-specific imaging markers. The anterior versus posterior index measures the differences in atrophy between the frontotemporal regions and parieto-occipital regions, making it a useful imaging biomarker for frontotemporal dementia. Other specific imaging biomarkers are MTA and GCA, which estimate computationally the corresponding visual rating scale used widely in Europe. By selecting FLAIR images, the tool provides the volumes of white matter hyperintensities and provides a computed Faziker scale used in Europe. You can also review segmentation here as well. In addition to cross-sectional analysis, cNEURO provides specific tools for longitudinal analysis, both for assessing atrophy rate from T1 images and the change in lesion volumes from FLAIR images. In this view, the images from two sessions have been aligned, enabling their visual one-to-one comparison. The user can switch between the first and second time points and visually inspect the differences in between the images. To better see the differences, the user can overlay a difference image on the original image. In this case, we can observe clear expansion of the ventricles, which is indicated by the red colour. The quantitative results confirm this visual finding. They show about a 5% expansion over 1 year. Percentile curves can also be viewed for any of the structures. The lesions from FLAIR images can also be analysed correspondingly. The user can toggle between the time points and visualize the differences in the images, but in addition, growing, stable, and shrinking lesions can be shown. We can click on Reports, which has 3 copies. There is one for the clinician, one patient-friendly report for communicating results to patients, and a longitudinal report. In cMRI, we contrast imaging biomarker values with reference data from healthy people, but obviously clinicians are interested in diagnosing what the disease is. MRI is just one piece of a diagnostic puzzle, and clinicians often use other tests in making a diagnosis. So let's look at another case in our cDSI tool, where DSI stands for Disease State Index. To the left, we have a dashboard with available data for this patient, which includes results from CSF samples, neuropsychology tests, genetic markers, and the imaging biomarkers taken from cMRI. cDSI is a machine learning tool that has been trained with data from previously diagnosed patients. The tool compares the patient to previous cases and measures how similar the patient is to previously diagnosed Alzheimer's, frontotemporal dementia, vascular dementia, and cognitively normal cases. This case is pointing towards Alzheimer's, as Alzheimer's has the highest DSI value. Although cDSI is based on machine learning, it is not a black box. You can explore why Alzheimer's is the most likely case based on the available data. So, as much as this is an AI and machine learning tool, it allows you to see exactly why it is pointing towards one particular disease over another and how strongly, enabling you to scrutinize the data. There is also a progression model here, so you can compare your patient from stable versus progressive MCI to assess the risk of your patient progressing towards dementia. Thank you.